Hello, I'm Dr. Saida Rukshida. I'm a psychiatrist. I'm based in Mumbai, India. Today I'm doing a quick video in between sessions. So it's rather casual, but it's very, very important. A lot of people have reached out and said that they would want me to do a quick, informative video on depression and depressive illnesses. Major depression, dysthymia, chronic depression, affective disorders, mood disorders. These are words that we've been hearing a lot lately. Thankfully, we want mental health and mental illnesses to be part of our everyday living room conversations because we want to normalize mental illnesses and mental health. But we also use it very, very easily and very, very casually that, oh, I'm depressed, or, oh, I have depression, oh, I always talk like a depressive person. What we need to understand is that depression, major depression, is a medical illness. It's a medical illness that is a genetic illness, somebody with a predisposing genetic vulnerability for a depressive illness, for major depression, is going to be at higher risk of getting this illness. Just like if I was at a higher risk of, let's say, hypertension or diabetes or thyroid disorder, maybe because of something in my inherited genetics, or maybe it's my own genetics. So it's a genetic disorder. It's a neurochemical disorder. That means it happens in the brain. It changes your brain structure. It changes your brain chemistry, electricity, the way it functions, the way it impacts other functions of the brain. It doesn't discriminate. It can happen to anyone. It can happen to a young person. It can happen to a child. It can also happen to an older adult. A lot of us are used to saying that, oh, with old age, a little depression is normal. No, it's not. It's an illness. Having an illness is never normal, right? So we need to understand that I might be in a low mood. I might be going through a mood, or I may be feeling sad or low, or I could just today, or maybe in the last few days, because maybe something happened in my life, or I got a bad news or something like that. But that does not mean that I have an illness. So for me to have depression or any other psychiatric illness, but we're going to talk about depression today. For me to have depression, I need to have sustained, consistent symptoms that are lasting for more than 2 to 3 weeks. Right? So anything over 15 days, if I'm consistently finding that I'm suffering with, I should understand that I have to go see professional help and get a diagnosis. Now, so what are these symptoms? What are these signs that I need to look for? Because depression is an illness that will impact my thought, the way I think, the way I respond to even social cues for that matter. If somebody's smiling at me, I might think that, oh, this person is not happy with me, or somebody is angry with me. I might not realize that this person is so annoyed with me right now. It can impact the thought that it makes me feel very helpless. It makes me feel very hopeless. It makes me feel worthless, that I can't really do anything about it. It can impact my thought process that I feel that this life is not worth living, that I would want to die. I wish something would happen and I would die. Or possibly having an active suicidal idea where I want to die. I make a plan of how do I want to kill myself. It impacts my emotions. It makes me sad. It makes me irritable. It can make me have mood swings. It can make me feel very blunted, as if I don't feel anything at all. So it can impact my emotions. It can impact my behavior. It makes me slow. I might be taking more time doing something that I ordinarily would have taken a shorter period of time. It impacts my cognition, how I can concentrate, whether I have a decent memory anymore. I seem to be more distracted, more forgetful of late. I can't seem to be studying as much as I could have in the past. New learning is getting impacted. It can impact my problem solving ability. So even a simple, small little thing that how do I fix this or how do I make this can baffle me and completely, destroy me at that moment. I could have a lot of other symptoms like physical illnesses. I could have pains and aches that I can't explain. The doctors keep telling me that I'm okay, but I still feel the pain because it reduces my pain threshold. So I can have a lot of these kind of symptoms. If you have these symptoms or some symptoms similar to these, the ones that I have described, for more than 15 days, then you might want to consider that you have an illness and you have to get it diagnosed. Okay, so what do we do if we think that we have an illness or somebody near us has an illness? We need to seek professional help. You need to see a psychiatrist or maybe even an MPhil or a PhD psychologist who could diagnose this illness, right? Because diagnosis is very important. That's the first stage. We might have to diagnose if you have only depression or this is because of something else, like if I have a thyroid disorder or if I have Parkinson's or if I'm on certain medications that might be triggering my depression. Because depression is a medical illness which is not really, it's not something because I'm weak or I'm thinking in a particular manner. It's because it is triggered by an environment. The environment could be within me. Like I said, I could have an illness, or the environment can be without me. That means I could be going through sustained amount of trauma or abuse or stress for that matter, whether at work, whether at home, whether in a relationship, that could trigger the medical illness of which I have a genetic predisposition, a genetic vulnerability towards. So the more the environmental trigger is also something that a doctor needs to look into. Maybe that is something that needs to get fixed. Like if I have a thyroid disorder, if I don't get that fixed and I'm only trying to treat my depression, I might not be successfully treated, right? So the proper diagnosis has to be made, some tests have to be run, and then a treatment plan has to be worked at. The treatment plan will include medications and counseling and therapy. Especially if you have a depressive disorder of moderate to major or moderate to severe intensity, medications are very, very important. Medications are not something that we are going to be worried or scared about. Medications help us be who we are. They're not addictive. They don't increase your weight. They don't make you lethargic. They're not mind altering drugs. Of course, medications can have certain side effects, but please ask your doctor about them. They can be life-saving. Imagine somebody who's suicidal, or somebody starts having alcohol or other drugs because they are so upset with how they're feeling and how they're thinking. So these are definite complications of untreated depression. And if you're only misinformed about medications and that's the only reason you're not taking them, that's not fair, isn't it? It's not fair to you. So ask your doctor all your questions about side effects of medications. Most psychiatrists are very straightforward and they'll tell you what to expect and what not to expect. And of course, if a certain drug is not helping you, if it's not suiting you, they will change it. There's a difference between counseling and therapy. Counseling is where somebody can be supportive, somebody can help you, verbalize your emotions and your thoughts. They'll sit and listen. Therapy, on the other hand, is a structured program where a psychotherapist, whether that's a psychiatrist or a psychologist, will teach you when you have these kind of thoughts or when you have these emotional swings, what can you think, what can you do, how to manage your behavior. And psychotherapy can also be very, very important in terms of your life skills, in terms of coping skills. So not just as a treatment modality, but also in terms of, further improving your life skills. Therapy can be very, very beneficial. It's important that you understand who are you getting treated from, whether they're qualified, whether they're good at their job. If you have any concerns, go ahead, take a second opinion. There's nothing wrong. After all, you must prioritize yourself. And when you are under treatment, there is no shame because you need to understand it's a medical disorder. Just like anything else, you may be a little worried and a little scared, but you will get better. Depression is a treatable illness. Untreated depression can lead to a lot of undesired complications, including a bad quality of life, or maybe suicide, or maybe even substance abuse. It impacts our daily functioning, it impacts our relationships, it impacts how we look at ourselves. So a simple thing like depression that is very easily treatable. It's the reason I'm saying it's a simple thing because it's a common medical disorder. It's a common psychiatric disorder that is handleable. And because of myths and misinformations and fears, we don't tend to take psychiatric help. So please go ahead, take care of yourself, take care of your loved ones. If you suspect yourself or somebody else having a depressive illness, don't wait, ask for help, take treatment, and get well.